Hello Kisumu, I'm Dr. Charles Otieno, practicing physician surgeon within the Greater Los Angeles area in California. I have been a part of the Africa Sickle Cell Disease Project since 2018, now Consortium on Newborn Screening in Africa. Today marks a very important milestone for the county of Kisumu, one of the regions with the highest prevalence of sickle cell disease in Kenya, and a milestone to all the sickle cell warriors and their families. This is a foundation stone of sickle cell disease management in Kenya, and according to the World Health Organization, close to 240,000 newborns are born each year with sickle cell disease in sub-Saharan Africa, the highest in the world, and the majority of them do not attain the age of 5. Kenya tours its burden with about 6,000 births per year, with sickle cell disease at 2 to 4% and up to 50 to 80% of deaths before the age of 5 in the high prevalent regions. Sickle cell disease has been recognized as a public health problem by the Kenyan Ministry of Health, and recently the National Guidelines for Control and Management of Sickle Cell Disease in Kenya was launched, was dated April 2020. The Consortium on Newborn Screening in Africa, CONSA, is a part of the American Society of Hematology program, which aims to strengthen sickle cell disease care in sub-Saharan Africa, where sickle cell disease is endemic, and this is in partnership with local government. Our team in the US approach is to create programs in the region that yields results and outcomes in the management of this devastating disease. We want outcomes that support data, not data in terms of research without sustainable outcomes. As a part of the Kisumu Comprehensive Sickle Cell Consortium, our team, one, Unigen LLC, is a US-based pharma company, and two, Beyond 5 Campaign, a non-profit organization, and others, are committed to leading Kisumu to a phased-out project. Unigen have developed a pediatric-friendly formulation of hydroxyurea, which will be in the market soon, and other medications needed in the early intervention as a sickle cell kit. They will also focus on educating the community about sickle cell disease awareness and management, and to make this pediatric formulation accessible to every patient living with sickle cell disease in the region. Hydroxyurea has been proven to be very effective by one study realizing effectiveness across continents with hydroxyurea, the REACH trial, which investigated the feasibility, safety, and benefits of hydroxyurea treatment for children with sickle cell disease living in the sub-Saharan Africa region. Studies have proven that the use of hydroxyurea as early as 9 months will improve outcomes, will reduce morbidity and mortality of these children. The Beyond 5 campaign, which is a non-profit organization, is working on a global promotional awareness of sickle cell disease, and the theme is Break the Silence 2022. We are the world for children with sickle cell disease. The aim of this awareness is to alert and remind the global health community of the devastation of this neglected disease. Africa cannot tackle this disease alone. We want the global health community to fast track and place sickle cell disease at a similar level with HIV, malaria, and tuberculosis management in Africa. And now we have COVID-19. We appeal to the Global Health Fund through WHO and UNICEF and other international donor communities to provide maximum support to sickle cell disease. We want the Global Health Fund to support screening programs, early intervention, and hydroxyurea accessibility in the region, since it is now a part of the WHO Essential Drug Program. Phase 1 will be newborn screening and early intervention with CONSA. Phase 2 will be screening for stroke risk with ultrasound Dopplers and prevention interventions with apheresis and red blood cell exchange. Phase 3 will be bone marrow transplant, stem cell to gene therapy. We envision that Kisumu will be the regional comprehensive sickle cell center based on its strategic location, infrastructure, and leadership. Last but not least, I sincerely want to thank the American Society of Hematology through the CONSA project, and a special thanks to Dr. Alexis Thompson and the leadership at American Society of Hematology led by Chase, who mentored us about requirements until our inauguration into the program. A special thanks again goes to Kisumu County leadership from our Honorable Governor, Professor Anyang' Nyong'o, who we have walked along this journey, his visits to the US, to the City of Hope, to visit the Bone Marrow Center. Thanks to the Kisumu County Ministry of Health, JOTRH, and the team that have worked tirelessly to finally hatch this project. And my very special thanks again goes to Dr. Rai, Dr. Gonda, Dr. Wanda, and Dr. Okoth for the many calls and meetings we had. The journey began in San Diego, California, to Johannesburg, South Africa, to Orlando, Florida, and now we are in Kisumu City. Let's finally break the silence for all our children with sickle cell disease. Together we can, and we should not let any newborn die before the age of 5. Thank you all, and God bless you. Thank you.